In the quiet stillness of the night, our bodies often reveal secrets that go unnoticed during the busyness of the day. For men across the world, nighttime can bring about subtle changes, some so faint they might be brushed aside as just another restless evening. But what if these signs were more than just a passing discomfort? What if they pointed to something deeper, something that could affect your health in ways you never expected? Tonight, we're shining a light on a topic that deserves your attention: the alarming symptoms of prostate cancer that emerge after dark. If you or a loved one has noticed unusual changes at night, it's time to pay close attention. Your health could depend on it. Before we dive into the 5 alarming nighttime symptoms of prostate cancer, let's take a moment to understand why this matters. Prostate cancer is one of the most common cancers affecting men worldwide. While some symptoms are obvious during the day, others become more pronounced when the world quiets down and your body goes into rest mode. Recognizing these warning signs can be the difference between early detection and missed opportunities for treatment. Let's start with the first symptom: a restless, urgent need to urinate, often multiple times throughout the night. Imagine settling into bed after a long day, only to find yourself getting up again and again to use the bathroom. It's more than just annoying. It's a signal that something could be wrong. Nocturia, or frequent nighttime urination, is a classic sign of prostate issues, including cancer. The prostate gland surrounds the urethra, and when it becomes enlarged or affected by tumor growth, it can press against the urinary tract, making it difficult for the bladder to empty completely. This leads to that persistent urge to go, disrupting your sleep and leaving you feeling exhausted. Think about how this constant interruption impacts your life. You're deprived of deep restorative sleep, which can lead to irritability, poor concentration, and even health issues like high blood pressure. But beyond the inconvenience, what truly matters is the underlying cause. If you're experiencing nocturia regularly, especially if it's getting worse over time, it's not something to ignore. While other conditions like benign prostatic hyperplasia or diabetes can cause frequent urination, persistent changes at night could be a red flag for prostate cancer. The message here is clear. If your nights are punctuated by repeated trips to the bathroom, it's time to talk to your doctor. The second alarming symptom is something that's easy to dismiss: a weak or interrupted urine stream. Picture yourself in the middle of the night, struggling to urinate, only to find that the flow is weak or stops and starts unexpectedly. This isn't just inconvenient. It's a sign that something may be obstructing the urinary pathway. The prostate's position around the urethra means that any swelling or growth can restrict the flow of urine, making it difficult to empty the bladder completely. Over time, this can lead to discomfort, frustration, and even urinary tract infections. But what's truly unsettling is how subtle this symptom can be. Many men chalk it up to aging, thinking it's just an inevitable part of getting older. But when the pattern changes, when you notice a sudden drop in the strength of your urine stream, or you're straining to start or finish urinating, it's time to pay attention. These changes don't just impact your comfort, they reveal what's happening inside your body. Prostate cancer can grow slowly, but when it begins to affect the urinary tract at night, it's sending a clear warning. If you're experiencing a weak stream, don't wait. Early intervention can make all the difference. The third symptom is one that hits especially close to home: pain or discomfort in the pelvic area, often intensifying at night. The quiet of the evening can make aches and pains more noticeable, especially when you're lying in bed. Some men describe a dull ache, while others feel sharp pain radiating from the lower back, hips, or thighs. This discomfort isn't just physical. It can disrupt your sleep, sap your energy, and leave you feeling anxious about what's going on inside your body. Pain in these areas can be caused by a number of conditions, but when paired with other symptoms like changes in urination, it's a sign that something may be wrong with the prostate. Cancerous growths can press on nerves and tissues, triggering pain that's at its worst when your body is at rest. If you find yourself waking up at night because of pelvic pain, or if the discomfort is persistent and unexplained, don't ignore it. Pain is your body's way of asking for help. It's time to listen and seek medical advice. The fourth symptom is a bit more subtle, but no less alarming: blood in your urine or semen, sometimes visible only at night or in the early morning. Discovering blood where it shouldn't be is always unsettling. It's easy to dismiss a small amount as a one-off occurrence, but even a trace could be a sign of something serious. Prostate cancer can cause bleeding in the urinary tract, leading to pink or reddish discoloration in your urine or semen. Sometimes, this is only noticeable in the morning, after your body has been at rest for hours. This symptom is particularly important because it can be easy to overlook, especially if it's intermittent. But any unexplained bleeding should prompt immediate attention. Blood in the urine or semen isn't just a nuisance. It's a signal that something is wrong in the prostate or surrounding tissues. If you spot blood, don't wait to see if it goes away on its own. Reach out to your healthcare provider and get checked. Early detection is key to beating prostate cancer. The fifth and final alarming nighttime symptom is unexpected erectile dysfunction. While sexual health can be affected by a variety of factors, a sudden inability to achieve or maintain an erection, especially when it's out of character or paired with other symptoms, deserves your attention. The prostate plays a crucial role in sexual function, and cancerous changes can disrupt the nerves and blood flow needed for an erection. Some men notice that their nighttime erections become less frequent or disappear altogether. This symptom is often overlooked due to embarrassment or the belief that it's just a natural part of aging. But when erectile dysfunction appears suddenly or worsens quickly, it's a sign that something could be wrong. If you're experiencing changes in your sexual health, especially if you're also noticing other nighttime symptoms, it's time to get checked out. Your health and well-being are worth it. Let's pause for a moment and reflect. Maybe you recognize one or more of these symptoms in yourself or someone you care about. It's natural to feel anxious or uncertain, but what's most important is taking action. Prostate cancer is highly treatable when caught early. The real danger comes from ignoring the warning signs and hoping they'll go away on their own. You owe it to yourself and your loved ones to prioritize your health. You might be wondering what steps to take if you've noticed these symptoms. The answer is simple. Schedule an appointment with your healthcare provider. Don't wait for the symptoms to get worse. A thorough medical evaluation, including a digital rectal exam and a PSA blood test, can help determine if further investigation is needed. Remember, these nighttime symptoms aren't always caused by cancer. Benign prostatic hyperplasia, infections, or other conditions can produce similar signs, but only a professional can give you the answers you need. Let's talk about why nighttime symptoms matter. During the day, distractions and activity can mask subtle changes in your health. But at night, when your body is at rest, symptoms often become more pronounced. The frequent urge to urinate, weak stream, pain, blood in urine, and erectile dysfunction aren't just inconvenient. They're signals that demand your attention. Ignoring them could delay diagnosis and treatment, making recovery more difficult in the long run. It's also important to recognize the emotional impact these symptoms can have. Sleepless nights can lead to fatigue, irritability, and anxiety. The uncertainty of unexplained pain or bleeding can weigh heavily on your mind. If you're feeling overwhelmed, remember that you're not alone. Millions of men face prostate health challenges every year, and there's support available. Talk to your doctor, reach out to loved ones, and don't be afraid to ask for help. Now, let's briefly touch on some risk factors for prostate cancer. Age is a major factor. Most cases occur in men over 50. Family history also plays a role. If your father or brother had prostate cancer, your risk is higher. African American men have a higher risk of developing aggressive forms of prostate cancer. Lifestyle factors, such as poor diet and lack of exercise, can also contribute. While you can't control your genetics, you can take charge of your health by being proactive about screenings and paying attention to symptoms. Prevention and early detection are key. Maintaining a healthy diet rich in fruits, vegetables, and lean proteins can support prostate health. Regular exercise, limiting alcohol, and avoiding smoking are also important. But most crucial of all is listening to your body, especially at night. If you notice changes, don't wait. Get checked. Let's recap the 5 alarming nighttime symptoms of prostate cancer. First, frequent nighttime urination that interrupts your sleep and leaves you feeling exhausted. Second, a weak or interrupted urine stream that makes it difficult to empty your bladder. Third, persistent pain or discomfort in the pelvic area, lower back, hips, or thighs that's worse at night. Fourth, blood in your urine or semen, even if it's only a trace or happens occasionally. Fifth, sudden or worsening erectile dysfunction, especially when paired with other symptoms. Each of these symptoms is more than just a nuisance. They're your body's way of asking for help. Recognizing them early can make all the difference in your health and quality of life. If you've made it this far, I want to thank you for taking the time to learn about a topic that's often ignored, but so important. Your health is your most valuable asset, and being informed is the first step toward protecting it. Whether you're experiencing these symptoms yourself or supporting someone who is, remember, you're not alone, and help is available. As we wrap up, I want to leave you with a strong call to action. Don't ignore the signs. If you or a loved one is experiencing any of these nighttime symptoms, reach out to your healthcare provider today. Early detection saves lives, and there's no shame in seeking help. Share this information with your friends, family, and colleagues. You never know who might need to hear it. Thank you for joining me on this important journey to better health. If you found this information helpful, please hit the like button, subscribe to our channel for more health tips, and share this video with anyone who might benefit. Your support helps us bring you the latest, most accurate health information, and together we can make a difference. Take care of yourself, stay healthy, and remember, your health comes first. See you soon.